Rehman Chishti.
Thank you. Just a question to start off, if I may, with Ms. Corlett. I'm from Kent, and Kent Police have been rated outstanding for 3 years by the HMIC inspections that take place. And they've looked at a number of different measures they've taken in relation to addressing the point on mental health. A third of the police time in Kent is spent on mental health. One thing which they've used is having mind counsellors in their police control rooms to help identify and address the issue early on. From your experience, are enough police forces around the country doing enough of those initiatives to help address this challenge?
Well, that's a sort of a version of street triage, even though it's not on the street. Street triage is a bit of a misnomer. I suppose it's providing advice to people on the street, to police on the street. There are about 17 of those operating across the country, which actually we would like to see them everywhere. We've had an evaluation of street triage, although it was when it was first set up, but actually the model has changed quite significantly, and even that evaluation was of a number of different models. So we've heard people say variously, oh, it's not really been researched, it's not been properly evaluated, and therefore we don't want to take it up. But all the areas that have taken it up, I think I'm right in saying, have found it incredibly useful. And actually, no, they haven't found it incredibly useful. Many have found it useful.
Many have found it useful. It is fair to say the evaluations are, not just in my opinion, but in the opinion of the National Institute of Health and Care Excellence, poor. That was their word, it wasn't my word. In Kent, for example, they did have street triage with a double-crewed car in the model that we see in the northeast of England, and after they disbanded that because one of the things about the difference between Kent and, for example, Newcastle is that Kent is a large rural county with towns in it, as opposed to an urban city, which is a condensed geography, and they just couldn't physically get to everything that they're trying to respond to. Therefore, the solution of having mind counsellors in the control room was one that meant you didn't have to get the nurse to the job, they could advise from the control room.
What we need is proper evaluation of those different sorts of models, so we can work out what works for what sort of area. One of the key things that people need is access to mental health knowledge, but the other key thing that people need is access actually to people's records. So in that sense, a link into the mental health service is really key. So, what is it that people need, and how can you really make sure that people get it? And then is it having an impact on the numbers of people that you're detaining?
And just a clarification on that, I think the point on Kent, although vast parts of Kent are rural, areas like mine in Medway are very urban, areas like Thanet, so you've got a mixture in Kent of urban and rurals, and I think the police force there uses street triage and the counsellors in the control room. I think it's a combination of the two. But the point if I may ask again, is in relation to mental health, the provision of mental health across the different police areas. Where would you say there is best practice that you see on helping address this?
Best practice is quite difficult. I don't know whether colleagues
because I don't want to ask police officers, I'm asking you from mine, so at least that way you can't then say one police force is saying that, but from mine's perspective, looking at it across the board, you would have seen it across the board, is there some police forces say, do you know what, across the board, overall, they've got it right, better than others?
I think it's quite difficult to pin it down to the police force, because where you've got it right is where the police force and the health services are working really, really well together. And that actually means that the health service have to have been stepping up as well. So there's some really great work being done in London, for example, which is a very complicated area because of the different boroughs, because of the different mental health trusts, because there's 3 police forces effectively that are operating, if you take into account the British Transport Police as well. But they have started to plan how that works if somebody is picked up by the police, if they're taken to A&E, if they need to be in a health-based place of safety. That's not fully rolled out yet, but the fact that they've been planning that together, that they're thinking about where they'd build new health-based places of safety, how they would organise that, how they would understand when somewhere's free so that the police aren't wasting time phoning round, that to me is absolutely a model of good practice. At the moment, though, in London, they're still having to take people to police cells at some points because that's a complicated area and they haven't got there. But it, as a model for how to work, that would be a good one.
Sure. Just a point to Chief Constable Phil. You talked about earlier the number of different challenges, the issue of collaboration, dealing with missing people, dealing with terrorism, dealing with the issue of mental health issues. One of the issues that comes up, and just looking at on counter-terrorism and the issue of mental health, and it's not always the case, looking at comments here from the Royal College of Psychiatrists now, where there's individuals identified in group-based terrorist acts, there's not necessarily an issue of mental health, but when there are lone wolf individuals, there is, at times, issues of mental health. And the point I come back to is made by the former Assistant Police Commissioner, Mr. Rowley, dealing with counter-terrorism, and where he said since 2011 on Prevent, all NHS bodies must train staff to spot signs of radicalisation and report people they fear to be at risk of becoming terrorists to the security services. He then goes on to say, yet the claims that there is a lack of trust between the NHS and the police in stopping crucial information from being shared. On that, from your experience in relation to frontline policing over 33 years, do you think there is that lack of trust in sharing that crucial information?
I think that there are inevitable barriers that are put in place to impair and inhibit public services from working more coherently and closely together. The Data Protection Act, protecting personal data, is one of those areas that impairs and inhibits conversations between agencies. So I don't think it's individuals within the health service that are being difficult or creates that lack of trust or distrust. I think that on occasions there can be a misinterpretation of some of the legislation, and I think on occasions we are risk averse and we're not lawfully audacious, and we should be. And I think that as we push our organisations closer together and we move towards greater integration, I think that will enhance the service that we're able to provide the most vulnerable in society.
Yeah, and the reason I say that, because that came across from a research done by the BMJ, who found that between 2015 and 2016, there were only just 75 referrals by 79 acute trusts across England to the police. And that's what then led to the Assistant Police Commissioner making that point about the lack of trust, collaboration between the NHS and policing. So you'd say there needs to be better guidance on how that's done?
I think there needs to be greater confidence between leaders within public sector organisations and greater courage. But I also think that the same way that police officers and police staff have a requirement to be trained, I've got no doubt that is the same in the healthcare setting. The training that we give our officers and staff around missing people, mental health and the other responsibilities we've got does not replace mental health services. It doesn't replace health services. It doesn't replace social services. What it does is increase the professional curiosity within our organisations. And I guess if we raise the awareness across the health service and with healthcare professionals to have that professional curiosity, that then may increase the number of referrals that are taking place. But I think that all organisations in the public sector are up against it in terms of enhancing our knowledge and understanding to raise the professional curiosity. I do not think people go out with a specific intent of not sharing information. I think that there are many other inhibitors.
I think that's the point I make there is, but it's not wanting to do it, but the clarification of the guidance and how it applies, that needs to be better done. Just touching on missing people, in 2015 and 2016, the last recorded year, there was an increase of 20% calls relating to missing people on the previous year. What was the main reason leading to that, from your experience?
So when I took over as the national lead, it was clear that there was inconsistency across the whole of the police service and across local authorities about what you would record, how you would record it. There was an inconsistency in relation to how we would describe missing people. There was the absent category, that wasn't always recorded as missing people. I think the increase is being because there has been an increase in episodes. And I think that also there is a significant administrative increase because we are now no longer suppressing the numbers because the absent category is no longer a demand management tool. It is used to understand risk and so that we've got the policing response that is commensurate with the risk. So I think as we improve our systems, as we improve our data collection, inevitably there is going to be an increase in the number of episodes. However, notwithstanding that, the minimum is just under 250,000 incidents of missing children and adults is a huge and significant resource demand on policing. And of course, 122,000 of those are missing children. And the complexities of dealing with adults and children are significant and huge. And all we need is for one of those to end tragically, and then of course missing people agenda or the issues of missing people goes up the agenda. I don't want it to go up the agenda because of a tragedy.
Yeah.
I want it to go up the agenda because it's the right thing to do, and the policing response along with the public sector response is coherent and sophisticated and seamless.
Just a clarification on that final point. In relation to missing people, linked to that is the real distress and pain and anxiety it causes the loved ones who have to deal with the onset of a number of issues. And we all as Member of Parliament have our own different experiences. And I had one of those very experiences where a constituent came to see me saying that my cousin has been listed as missing high risk and with the police force on the other side of the country, and as a result, because my constituent did not have the guardianship order, the problems of financial issues, the person is missing, dealing with their bills, dealing with their mortgages, that third party, my constituent, does not have any authority to deal with that. And they go to the police and they say, that's a legal matter, you need legal advice, we can't advise you on that. And I know the government were looking at having a missing persons bill in 2017 to help address some of those issues, because hopefully that loved one can be found, and when they come back, at least they've got their house and the bills have been paid by a loved one. In relation to having a joined-up collaboration approach, so when they go to the police and raise their concern, and the individual is listed as missing, at the same time, can there be any clarification or collaboration between the police or the charities such as Missing People, when they say, look, we will do everything we can to find your loved one, but in relation to the onset of issues, here is a document that may help you address some of the other challenges that you may be having, like the ones which I experienced. Because what then happens is the police write to my constituent saying, I'm well aware that legally you are in a limbo. We have the Minister of Justice saying to me, the gap in the law has proved problematic. So it's a combined approach. They're dealing with their loved ones being missing, but can there be a greater collaboration between all the agencies to make sure that person gets all the advice on how to deal with those onset of issues?
The first thing is that Missing People, along with the other incredible charities that help and support those people who have people in their families that have gone missing, do an incredible job.
They do a great job.
If we require enabling legislation to help those people that are suffering in the way that you've just described, then it needs to happen. I cannot think of an incident where police officers or police staff wouldn't go to the nth degree to help and support people who were having to deal with the trauma of losing or having to deal with the trauma of someone going missing from their family. But ultimately, it is the legislation that inhibits people moving on in their lives. So the legislation, however difficult it is for the legislatures, needs to change to grease those wheels. Just
on that, so you're of the view that the legislation in this, the enabling legislation in this, needs to change. And just on that basis, how would you say it needs to change?
If families are not able to move on in their lives, and it is because of the legislation that stops them from doing that, then I think we should all work together to define how that legislation changes and enables people to move on. In terms of the specific detail, I couldn't.
No, of course, I get that. The only point I'm making is I thank the police for doing a brilliant job what they do, and I've seen that from the experiences from constituents and also the charities like Missing People. The reason I ask that, it's often then good to ask those on the front line, how do we sometimes change that legislation? Because there is not one way always how to deal with that. But I appreciate it.